Hi, Mr. Smith. My name's Erin, and I'm going to be your student nurse today. I'm going to go over some important instructions and tips for your recovery at home. Please let me know if you have any questions as we go along. You were diagnosed with acute appendicitis, and you underwent a laparoscopic appendectomy. Your appendix was not perforated, which is good for recovery. The goal now is to help your body heal, prevent complications, and return to your normal activities safely. Because your appendix was removed laparoscopically and not perforated, your recovery may be quicker and complications are less likely than with an open or a perforated appendix. We want to keep your small laparoscopic incisions clean and dry. We want to wash your hands before touching them and change your dressings as instructed. So we want to watch for redness, swelling, pus, or increased pain. And you definitely want to call the clinic if you notice any of these signs. Small bruising or mild tenderness is normal for a few days. Regarding pain management, please take your pain medications as prescribed. Non-opioid medications such as acetaminophen or ibuprofen can also help if appropriate. Avoid taking more than the prescribed dose. Some mild cramping, bloating, or shoulder tip discomfort is normal from the gas used during your laparoscopy. Regarding activity, light walking is encouraged to prevent blood clots and help your bowels start moving. Avoid heavy lifting or strenuous activity. You may lift up to 10 to 15 pounds for the first 1 to 2 weeks. You may return to work or school in about 1 week as long as your job does not require heavy physical activity. Avoid driving if you are still taking narcotic pain medication as well. When we're looking at your diet, since you are not a perforated appendix or a complicated case, you can advance to a regular diet prior to discharge. Eat small, frequent meals, stay hydrated with water or other fluids, and gradually resume your normal eating habits. Some mild nausea or decreased appetite is common initially. Some signs to watch out for: you want to call your provider or go to the emergency department if you notice a fever greater than 101 degrees Fahrenheit, and that's 38.3 Celsius, worsening abdominal pain and swelling, persistent vomiting or inability to keep fluids down, redness, drainage, or foul odor from your incision, difficulty urinating, or sudden worsening weakness or confusion. Regarding follow-up, we want to schedule a follow-up appointment with your surgeon or primary care provider in 1 to 2 weeks to check your healing and remove sutures if needed. Bring any questions about activity, diet, or medications. Take any prescribed antibiotics to completion, even if you feel better. Avoid medications that were not prescribed to you. And you always want to consult your provider about any medications you may have questions about. Remember, your recovery is important, and following these instructions will help prevent complications and speed up healing. If you have any questions or notice any warning signs, please contact us right away. Wishing you a smooth recovery.